Hi everybody. Today I am answering the question, how long does it take to recover from caregiver burnout? If you're a family caregiver or a paid caregiver, you may be wondering about this question. This video responds to a question by a paid caregiver who relayed that this caregiver is experiencing burnout and they want to change, but in this particular care situation, family members of the person they care for are requesting more and more and more of the caregiver's time and attention. And this caregiver is feeling emotionally torn because they need to take care of their own health and well-being, which is starting to show problems, but they also feel responsible. Many family caregivers find themselves in an exact situation. So whether you are a family caregiver or a paid caregiver who's working in a private home, a care community, a nursing home, the effects of caregiver burnout and exhaustion are real. In this video, to answer the question, how long does it take to recover from caregiver burnout, I will talk about three things. One is aspects of a care situation for family and paid caregivers that cause emotional and physical stress. Number two, the effects of that stress on the care situation, including the person who needs care. And number three, how to remove yourself from a care situation that is causing emotional and physical burnout while feeling okay and not guilty about leaving the situation or changing the situation. I will be sharing perspectives from both sides of the situation. The paid caregiver and the family caregiver, and the individual and the family caregivers who rely on a family caregiver or a paid caregiver, regardless of the situation, a private home, a care community, a nursing home, wherever. So stay with me. If this is your first time on my channel, I'm Pamela D. I'm a caregiving expert, advocate, speaker, and educator who helps adults and their caregivers work through the health, financial, legal aspects, and family relationship aspects of caregiving. I also serve as an expert witness for law firms and clients in matters of guardianship and conservatorship, dementia and Alzheimer's care, care management, home care, and other topics. You can learn more about me and my professional background by going to my website, PamelaDWilson.com. There's also plenty of links below this video on my YouTube channel. Please do like the video, follow my channel, comment. Your participation helps other people find their way here. So, one of the goals of this video, in addition to the three things I mentioned, is to help caregivers understand the effects of burnout and to be okay with realizing that you may need a caregiving change. If you are a professional, this may mean a rotation in the person or the people that you care for. If you're a family member, this change may mean doing less while other people do more, or it may mean totally removing yourself from a care situation, depending on the status of your health and your well-being. When a caregiver quits or leaves a family situation, and this is a paid caregiver, the person who needs care and their family members can feel a big loss, disappointment, anxiety, because they depended on this caregiver and they actually felt a sense of relief that, wow, care situation is stable. Everything's going okay. We can worry less. We can relax a little bit. Now, if we're all being realistic, we know that care situations can change in the blink of an eye, and they do. A hospitalization, a new diagnosis, a change in physician, all kinds of things happen. And whether we like it or not, change can be hard. It can be disruptful to our lives. In a perfect world, we love stability, we love consistency, and we love comfort. Now, if we're lucky, we might have stability and consistency and comfort for short periods of time between change if we are a caregiver. Because remember, we create our own situations through our actions and the way that we react. So if you're a family member, you may know that hiring a caregiver through an agency or independently can be, a tricky path that requires a lot of effort to potentially interview and work with multiple caregivers until you find the right one or two or three. And then, once everything is running smoothly, what happens? A caregiver quits or leaves to go work with another client. Well, how can you avoid this? My suggestion is to work with more than one agency and more than one caregiver. So if one leaves, you already have an established relationship with another caregiver or another care agency. So there's some kind of continuity. You're not having to just start from scratch after doing all of that hard work to find a caregiver in the first place. Now, let's talk about the other side of the equation. A good client match is also important for a paid in-home caregiver. Because in-home caregivers, they want to get up and look forward to going to work every day and feel like they're contributing and helping other people. That's why most caregivers do this. The elephant in the room that nobody talks about or rarely talks about enough is caregiver burnout that happens with family caregivers and paid caregivers, and the effect on the caregiver and the effect on the family and the person receiving care, and how long it takes for somebody to recover from caregiver burnout. Nobody talks about this. We don't talk about it enough. And when I talk about paid caregivers, I want to relate this to caregivers who do come into the home, but also caregivers who work in care communities, in nursing homes, in hospitals. Caregivers are medical professionals like doctors and nurses. Taking care of anyone who has a health problem, especially the elderly who may not get better. It can be exhausting, emotionally exhausting, physically exhausting. It's definitely not for everyone. Burnout results from caring for the care receiver and dealing with everybody else, including their family members and maybe doctors and nurses and healthcare companies and all of that. Specific to dealing with family members, this goes, remember, I always look at both perspectives. This goes both ways. Family caregivers deal with family members, their parents, their siblings, maybe aunts and uncles, other people. Paid caregivers deal with their own family members, right? And then the family members of other people. And as we know, when it comes to caregiving and health problems and all the unexpected crazy things that happen, right? Family members can be emotional about care situations, which raises the difficulty and the complexity of the situation. For paid caregivers who are involved with more than one client or patient, and their family members and everything else going on, right? Multiply that level of complexity by the number of people that caregiver is in contact with. Multiple clients with multiple health conditions, that can be a learning curve for a paid caregiver. Then add on this, keep stacking it up, learning how to deal with different personalities of family members. Now, if you're a family member and you have complicated relationships with your parents or your siblings or your aunts and uncles or your grandparents, you know how hard your family is to deal with. Imagine taking all of that family stuff and moving it over here and putting it onto a paid caregiver who's coming into your life because maybe they're going to care for your parents or your spouse, and that caregiver having to try to get along with everybody that you may not even get along with. It's hard. It's stressful. It's distressful. Paid caregivers and family caregivers constantly respond to changes in health or condition and the worsening health of a client or a family member. A paid caregiver may leave for the day, they're done with work, they come back, and the next day they find out that client or patient has died. The difference is, in families grieve the losses. Paid caregivers, they're not given time to grieve. It's like, hey, you know what? Mrs. Smith died. Guess where you're going today? You're going to Mr. Jones. Their only grief is to say, oh my gosh, this person died, and now I got to go take care of client number 1, 2, 3, 4, and 5. Paid caregivers in care situations also deal with their work family, right? Office staff, schedulers, nurses, doctors, other people in the workplace. So it's kind of like double duty stress. Now, let's talk about caregivers that family members might hire who are independent contractors. They're self-employed, right? They work on their own and they don't really have support from anybody, right? There's no company behind them. You know, this may seem easier for family caregivers, but it means that any caregiver you hire independently really should have higher level skills to deal with all of this complexity that they don't have any support to deal with. And I say should because they always don't. Caregivers who are independent contractors can be wonderful. They can be amazing. And just the opposite, other side of the story, right? They can easily take on too much work, become personally involved with the client and their family members, which can lead to control issues. It can lead to that caregiver taking sides with one family member over another. Maybe that caregiver gets so ingrained and enmeshed in a family that they isolate the person they care for from family members just because they have the most contact with that person. Situations of elder abuse are very common with caregivers in family homes who have very little supervision and who really are accountable to no one because they're independent contractors. They manage themselves. So my advice is to be warned and be cautious. Mental, emotional, physical exhaustion, all caregivers experience this to different levels. So is it any wonder why a caregiver gets burned out? Why they might need a change? Is it any wonder why this caregiver said, Pamela, can you do a video on how I get myself out of this care situation and not feel guilty when family members want me to do more and more and more and more and more? Well, many family caregivers are in the same situation. So let's talk about number 2. What are the effects of the emotional and the physical stress on a care situation, which lead to why might you need to remove yourself or change that care situation? If you're a caregiver, you may love your job or the person you care for, but it can get to be too much. There's a point where you may need a little rotation in the people you care for or a total change in the situation. So how on earth do you know when you're there? Well, when you're beyond it, you really know. But when you're coming up to it, there's a few little signs. So there's studies out there all over the place about degrees of caregiver burnout and exhaustion. Studies confirm that about 40 to 50% of paid caregivers, and that's, caregivers who are working in homes and nursing homes and care communities, are exhausted and burned out. And so the way that they react, which if you are one of these caregivers, you might look at yourself and say, hey, am I doing any of this kind of stuff? You're beginning to try to detach from work, set it aside. You're less satisfied with your job. Going to work every day is I got to go do that again. I don't like this, right? And you're thinking about, gosh, maybe I should leave work. And if this isn't managed, in your company, there's probably a lot of high turnover. People are coming and going because they're burned out and management's not doing anything to deal with it. Also, if you're burned out, whether you're a paid caregiver or a family caregiver, you can be less empathetic toward people. You might snap, you're losing patience. You're like, I don't care about your problems. I can't care about your problems. I have my own problems. And adding a component of memory loss or dementia or Alzheimer's or mental illness just raises the difficulty of this care situation, because you just get to a point where you're like, I just don't even care anymore. I don't care anymore. Some caregivers who work in care communities might see this among their coworkers. They may see other staff who are abusive to patients or clients, who are neglectful, who are not getting their work done, rushing tasks, being impatient, all of that kind of stuff. Well, that adds more stress for everybody, right? For family caregivers, the rate of burnout is similar, especially if you are a caregiver, again, for a person with early memory loss, dementia, Alzheimer's, any type of mental illness. Family caregivers, how do you know? Well, you don't feel appreciated. You're more irritable. You're not sleeping. You're sleeping too much. You're not eating. You're overeating. You're stressed out all the time. You're angry. You're less empathetic. You're short. You argue with people. You don't really care when mom or dad or your spouse complains about something, right? You're just like, I'm done with this. I just want to quit and I want to run away. So caregivers across the board, whether they're paid or family, have a lot of similarities when it comes to burnout and exhaustion. Everybody has an emotional limit. I do, you do, this person does, right? For dealing with complicated and stressful situations. And we all have coping skills in the way that we deal with these. But when an emotional limit is reached, when that stress just goes off the charts, blow-ups, meltdowns, arguments, self-isolation, a lot of negative stuff happens and people just are not getting along. That's when it's kind of like too late and you've gone too far. So how do you come back from this so that you can refocus and figure out what to do? Well, a lot of caregivers try to separate the emotions from the task, right? So caregivers, whether family or professional, just focus on tasks. Okay, what is it I have to get done today? What are the 5 things or the 10 things? And I'm not dealing with anybody's drama. I'm not dealing with anybody's emotions because I can't deal with that right now. Now, the problem is the caregiver is looking at tasks. Everybody else, the family members, the person who needs care, they want an emotional connection. They want their concerns and their problems to be heard. They want empathy. They want understanding. Well, so does the caregiver, right? But they haven't received it. That's why they are where they are. There is a point where it is not possible for a caregiver to give to anybody else anymore. It's a breaking point. Many times it does break when situations become so complex. And examples of that are people that have a lot of health problems, one health problem after another, and they have high needs and they can't bathe themselves or dress themselves or get up out of a chair, or people with dementia who are verbally or physically abusive or who refuse care. It's just like, one more thing. Why can't this caregiving be easy? Sometimes it's just not. These behaviors place so much additional stress on a care situation. And caregivers, regardless of paid or family, who don't have experience in dealing with these health problems or communicating with other people appropriately, or they lack training, they burn out a lot more quickly, which leads us to the next question about caregiver burnout and how long it takes to recover. Number 3 is, how do you remove yourself from a care situation that's causing all this stress for you with feeling okay about leaving or doing less? So to put this in perspective, let me start by asking you a question. If you work and you've had a job or jobs, how many times have you changed jobs during your lifetime, and for what reasons? Caregiving. whether you are a family member or a paid caregiver, is a job. The complexity is that it can also be viewed as a duty and a responsibility when there are family attachments and expectations and cultural norms and all this societal stuff that just gets lumped on top of the caregiver, right? But really, it's work. It's still tasks and a list of things to do and projects and things that take up time, plus all of these emotional interactions and attachments. So, to remove yourself from a care situation that's causing you all this distress, or to change the situation, you have to consider your life, your health, and your well-being and put that at an equal level as all of this stress over here. Not like you're down here and the needs are up here, right? You got to bring it back into perspective. And then you look at time, right? So caregiving for an older person who, is probably going to have more health conditions over time if they have a lot. Sometimes it can be 10 years or 20 years or 30 or 40 more years if those complications started in midlife, like when somebody was 50 or 60. It's different from being a caregiver for a baby who grows up and becomes more independent with time and mostly takes care of themselves, and God willing, by the age of 18, they're self-sufficient and independent and they don't need their parents to care for them anymore, right? This aging and caregiving thing works in the opposite way. It's like that Benjamin Button movie, right? He's old and he's getting younger, but really caregiving is somebody's older and they're not getting better and they're getting older and older and older and older. So it's kind of that reverse situation, young versus old. So family caregivers have a job with this indefinite time frame, which can last years, right? And who knows what's going to happen tomorrow. Stressful. Paid caregivers, their situation depends on their role, right? So look at a career as a physician. Because of all the training and years of education they put into it, most likely, if somebody chooses to be a doctor, they're probably going to do that for their lifetime, because changing is like impossible, right? How do I change this when I put so much time into it? But yet they burn out. They have to change doctor's offices or health systems that they work for or situations, and it's okay. The same goes for nurses and other healthcare professionals. Other staff like CNAs or home care aides who work in private homes or assisted living or memory care or nursing homes, they may be in these positions because they want to be a nurse, or maybe they want to be a doctor, they want to be something else, or maybe they're doing this because they're trying to figure out, like, they don't want to be a caregiver and they're going to do something else, right? So those are more transitory. So for caregivers, there is this either tied to family or professional caregivers and investment in education, the difficulty of changing careers. For some it's a transitory job. Some in-home caregivers, believe it or not, are retirees who don't really even need the money. They just do this because they want to do something fulfilling. But that means that they may not be really committed to stay, right? It's like, oh, I'll go do this for 6 months and then I'll go get a part-time job here at Walmart and maybe I'll go, I don't know, park cars or be a bus driver or whatever. So with this said, and all this potential for emotional burnout and physical exhaustion, it's important to start recognizing signs of burnout early. If you're a professional caregiver, talk to your company about a change in a care situation. If you're a family caregiver, in a perfect world, you've talked about boundaries and set expectations early. Because once you get burned out, it can really take time to reset and recover from the level of stress that you have experienced. So let's say that maybe you're a paid caregiver and you've been caring for somebody with a lot of health problems, advanced dementia, and even though the family members love you and you love this person, you're just like, oh my gosh, I need a change. I got to do something else for 6 months so I can look forward to coming to work again, so I can be happy again. So you tell your company that you need a client who has much lower needs. Now, that's not, the family and the person that you care for may feel rejected, right? But truly, if you're burned out, how good are you going to be for them? You're probably not going to be good for them. So your requesting a change is actually doing everybody a favor. You're doing a good deed for everybody. For that family, because you just can't do that anymore. For your company, because you're going to stay, right? For yourself, because you're going to be in a better care situation. You're going to be happy to go take care of a person who has a lot less needs. It's good for everybody. Family caregivers, the same thing. They can get so burned out that they're neglecting care needs and they're impatient. And the relationship with the person they care for is not even like good anymore, right? So for family members in a perfect world, you establish care expectations and boundaries very early on. However, few caregivers know to do this, and really family members don't want to set boundaries and set expectations because families just don't do that, right? Or they shouldn't do that. Well, they should. So what does this look like? I, the caregiver, agree to help 5 hours every week, and I will do this list of things. Beyond 5 hours and this list of things, we have to find somebody else to help, which could be a sibling, another family member, a paid caregiver, somebody else. Now, if you're watching this video, you're probably maybe beyond this limit and you've moved to burnout or close to. So if you're in that situation, you want to make time to research and identify other care options for the person that you're caring for. So you're not just going to run away in the middle of the night and disappear, although I have had some caregivers do that. You're going to identify other care options and find somebody to take your place. So you're finding a replacement for yourself. Now, this can take time. So if you have siblings who aren't helping, maybe ask them to help and let them know why. And say, hey, brother, sister, I'm exhausted, I'm burned out, I got to get myself out of this situation. I've told mom and dad about it. Can you help me research care agencies and all that kind of stuff? Because, in 3 months I'm out of here. They can either agree to help or not agree to help. But you giving them this early notice takes away the shock of them finding out that you're burned out and you're exhausted and you're tired and you need help. If they refuse to help, at least you've asked them so that when you're gone and they can't say, well, you never told me, you never asked for help, because that happens, believe it or not. You also have to let the person that you care for know that you need a change, and that can be hard. But again, if you're not being the best caregiver, it shouldn't be hard at all, because the relationship isn't the best, the care isn't the best, it's not working. Set a time frame, pick a date on a calendar, and maybe both of you can look at identifying a different care situation, whether it's bringing caregivers into the home or moving your loved one into a care situation. Now, the even more complicated situation is if you're a family member and you've given up paid employment and you've moved in with your parents or somebody else, and you depend on that person for a place to live and money, maybe they promised that you could have the home when they died and all that kind of stuff. Well, if you're burned out, you probably have a much longer timeline because you have to get back out into the workforce, which if you've been out for a while can maybe be a little challenging because you've got to be able to support yourself while you find somebody else to take care of your loved one. Now, you may have a situation where somebody else, a friend or another family member says, hey, you know what? I see you're in a bad situation. You can come live with me for 6 months and you can focus on putting your life back together. That would be like an amazing situation. But to do that, you have to replace the care that you were giving to your parent or that person in your family by paid caregivers, services through Medicaid, moving them into a care community. That way you don't have to feel guilty about leaving and your situation is just going to move on. And you got to get yourself in gear to get your life back together in that short time frame. So, whatever the reason your need for change, it's valid. Burnout, exhaustion, health problems, feeling that you can't do it anymore. Your reason does not matter. The fact of the matter is you need to change. But you also need a plan to either totally remove yourself or reduce the time spent in caregiving. And creating that plan, it happens with you. It happens through your actions. And so if you want to make it happen, you do have to set that timeline, a date, set goals every week to make it happen. Hold yourself accountable to making it happen. Now, I know a lot of caregivers who find it difficult to do this. And I know caregivers who are like, well, what's my family member? What are they going to think about me, or all that kind of stuff, or disappointing somebody. Again, you're not abandoning somebody if you replace the care situation, which is possible. Yes, it's change. Yes, other people may not like it, but it's probably necessary for your health and well-being. So you have to do whatever it takes to reclaim your physical health and your well-being. And know that the time frame is kind of like an unknown, right? It's the time frame in which you commit to make it happen. So the time frame, people say, well, how long does it take to recover from caregiver burnout? Well, it depends on how quickly you can change your situation, what you're willing to do every day, what you're changing in your routine, where you're putting your mental thought, where you're investing your time, how you manage stress and exhaustion. So for some people, burnout, a few weeks, they're recovered, they're good. For other people, it can take months. For some people, it can take years if they have been a 24/7 family caregiver in a very difficult situation for a long time. Time frame depends on you. It depends on your individual situation and the complexity of the situation that you have been exposed to. There is a lot more information, support, advice, tips for caregivers on my website, PamelaDWilson.com. There's also a way to schedule a one-on-one consultation with me. There are hundreds of videos on my YouTube channel. I have a caregiver support group on Facebook called the Caregiving Trap. You can request to join. I thank you all so much for being here. I'm Pamela D. Wilson, a caregiving expert, advocate, speaker, and educator. Please do like this video, follow my YouTube channel, and comment below, even if it's only to say thank you. Your participation helps other people find their way here.